Hepatitis means inflammation of the liver. The liver is a vital organ that processes nutrients, it filters the blood, and it fights infections. When the liver is inflamed or damaged, its function can be affected. Heavy alcohol use, toxins, some medication, and certain medical conditions can cause hepatitis. The hepatitis C virus causes diabetes. It affects the brain, causing depression. It causes lung problems, neuropathy, fibromyalgia, cardiac problems, skin problems, arthritis, stomach problems, anemia, fatigue, and of course, cirrhosis. After cirrhosis comes decomposition. The liver stops working, the skin and the sclera become yellow, and your belly looks like you're pregnant. You're unable to process protein. You get anemic, confused, the kidneys stop working, and you may bleed to death. There are 5 main hepatitis viruses, referred to as type A, B, C, D, and E. These 5 are of greatest concern because of the burden of illness and death that they cause and the potential for outbreaks and epidemic spread. For example, hepatitis C is called the dragon because it sleeps for many years and one day suddenly it wakes up and ends your life. People who got infected 20 to 30 years ago may only just find out now. The hepatitis C virus is very old and it's very smart. It doesn't kill quickly like the HIV virus or like the Ebola virus. Hep C has chosen to infect the liver, which is the only organ capable of regeneration. It can remain hidden for many years, keeping its host alive and using our own immune system against us. TUDCA is a bile salt made by microbes, so it's largely dependent on the health of your gut microbiome. Studies have shown that TUDCA drastically lowers serum liver enzymes, which these are markers of liver inflammation. TUDCA has been used in Europe to treat cholestasis and cholestatic liver disease. TUDCA can also act as a chemical chaperone to enhance protein folding and to protect cells against endoplasmic reticulum stress. TUDCA can also improve the biochemical expression of chronic hepatitis. Doses range from 500 to 1000 milligrams taken 3 times per day. TUDCA is also now used by bodybuilders to protect them from the damaging effects of steroids and drug abuse. Glutathione. Developed chronic hepatitis B causes deaths in approximately 1 million patients every year. Therefore, natural drugs with a high therapeutic efficacy and minimal side effects must be developed for the chronic hepatitis B treatment. In a study aimed to relate the therapeutic effects of glutathione on chronic hepatitis B, a total of 104 patients were randomly divided into 2 groups. The control group, which received an intravenous drip of 0.4 grams of inosine injection with 250 ml of a 5% glucose solution once a day for 8 weeks, and the treatment group, which received an intravenous drip of 1,200 milligrams of glutathione on a daily basis. Glutathione treatment decreased the serum levels of asparaginic acid transaminase, alanine aminotransferase, total bilirubin, total bile acids, hyaluronic acid, collagen 4, laminin, transformin growth factor beta 1, tumor necrosis factor alpha, interleukin 6 and interleukin 8 when compared with the control group. These results indicate that glutathione treatment can improve liver function and can inhibit inflammation and hepatic fibrosis in the chronic hepatitis patients. You can increase your glutathione stores by supplementing with reduced glutathione, or taking S-acetylglutathione and N-acetylcysteine. In order to create glutathione in your body, you need selenium. Therefore, the recommended daily amount of 200 micrograms of selenium can be obtained from eating 3 Brazil nuts per day. You could check out my video on mercury amalgam dental fillings, as these can also cause a selenium and glutathione deficiency, and there's possible solutions in the video. You could also watch my video on antioxidants, anti-inflammatories, and on autoimmune conditions, as a lack of these nutrients can also increase inflammation due to insufficient antioxidants being present, and these neutralize the oxidative stress in the body, which over time, if left untreated, leads to autoimmune conditions. Milk thistle supplementation is commonly taken by hepatic patients across the world, yet its proven benefits remain controversial. Studies have shown improvements in liver function in people with liver disease who've taken a milk thistle supplement, suggesting that it could help reduce liver inflammation and liver damage. Milk thistle may be more of a prevention, as it will not reverse any existing liver damage. It will not cure an infection with hepatitis B or the hepatitis C virus. It can also take up to 3 months for a milk thistle supplementation to show its benefits. As for the dosage of milk thistle, for fatty liver, a 90-day study found that 250 to 375 milligrams of milk thistle per day helped to reduce fatty liver. Hepatitis B and hepatitis C infections have enhanced oxidative stress and lowered B vitamins in circulation. In order to avoid other health risks, nutrition status should be monitored, and limitation or supplementation of certain nutrients might be helpful for the hepatitis B and hepatitis C infected patients. You could check out my other video on methylation to help you determine if you require higher doses of individual B vitamins. And if you're getting them, be sure to buy a quality multi-B vitamin with B12 in the form of methylcobalamin at around 5,000 micrograms per day, and folic acid in the form of a methylfolate, such as a metyl tetrahydrofolate. The enzyme Serrapeptase is currently being studied for its diversity in clinical applications. Serrapeptase is a proteolytic enzyme, and is derived and purified from a bacterial source. It's grown from Serratia marcescens, and it plays a role in the digestion of proteins in the body. It's interesting to note that serrapeptase was first found in the silkworm's intestines. When the silkworm moth emerges from its cocoon, it dissolves the cocoon using this enzyme. Serrapeptase is currently gaining much recognition as a potential anti-inflammatory and analgesic substance. It's even been suggested that oral serrapeptase could be beneficial in the treatment of viral diseases like AIDS and both hepatitis B and hepatitis C. Serrapeptase may also have the potential of protecting the nervous system because of its anti-inflammatory actions and its potential ability to prevent the destruction of nerve cells. Alpha-lipoic acid has strong antioxidant properties, which may reduce inflammation and skin aging, promote healthy nerve function, lower heart disease risk, and slow the progression of memory loss disorders. Some data suggests that alpha-lipoic acid may alleviate liver cirrhosis through the inhibition of the TGF-beta SMAD3 pathway and through autophagy. In one small study, an effective and conservative regime combined 3 potent antioxidants, alpha-lipoic acid, milk thistle, and selenium, and these possess antiviral, free radical quenching, and immune boosting qualities. There's no remarkably effective treatment for chronic hepatitis C in general. Interferon and antivirals have less than a 30% response rate, and because of the residual viremia, a newly transplanted liver usually becomes infected again. The triple antioxidant combination of alpha-lipoic acid, milk thistle, and selenium was chosen for a conservative treatment of the hepatitis C because these substances protect the liver from free radical damage, and they increase levels of other fundamental antioxidants, and they interfere with viral proliferation. The 3 patients presented in the paper followed the triple antioxidant program, and they recovered quickly, and their laboratory values were markedly improved. Furthermore, liver transplantation was avoided, and the patients are back at work, carrying out their normal activities and feeling healthy. The author offers a more conservative approach to the treatment of hepatitis C that is exceedingly less expensive. 1 year of the triple antioxidant therapy described costs less than $2,000 when compared to more than $300,000 a year for a liver transplant surgery. It appears reasonable that prior to liver transplant surgery evaluation or during the transplant evaluation process, the conservative triple antioxidant treatment approach should also be considered. If there is a significant betterment in the patient's condition, liver transplant surgery may be avoided completely. Vitamin E has been shown to protect against liver damage induced by oxidative stress. Moreover, some pilot studies suggest an antiviral effect of alpha-tocopherol against hepatitis B. For best results, it would be recommended to get a natural food-sourced mixed tocopherol vitamin E supplement. Omega-3 supplements have been shown to improve liver function in some patients with non-alcoholic fatty liver disease, and also the administration of omega-3 fatty acids may reduce the infection rate and improve liver function and recovery in hepatitis B virus-associated hepatocellular carcinoma. This improvement is associated with suppressed production of the pro-inflammatory cytokines in these patients. Typical doses can range from 3 to 9 grams per day of an EPA DHA molecularly distilled omega-3 fish oil. Most people are deficient in magnesium, and magnesium is required for the proper functioning of over 300 enzymes in the body. Few studies have investigated the association between magnesium levels and viral hepatitis. However, one did show that magnesium supplements can prevent the Hep C virus replication by binding the Hep C virus to NS3 helicase. The best form of magnesium would be magnesium bisglycinate. In order to determine your dose, slowly increase until the side effects, such as diarrhea, are noticed. Then gradually reduce until you reach the maximum daily tolerable amount that doesn't cause any of these side effects. As magnesium is required for so many functions, supplementing for a few months can have profound benefits to health and well-being. Recent studies have shown that the turmeric compound curcumin was found to effectively suppress a large number of viruses. The compound was previously known to defer cancer growth, resolve lichen planus, reduce type 2 diabetes, and to prevent Alzheimer's disease and dementia onset. However, a new article recently published listed several other studies indicating that the compound was also able to inhibit the growth of a plethora of viruses, including the Zika virus, hepatitis, herpes, influenza A, HIV, and HPV. According to a team of researchers from the Pasteur Institute in France, the turmeric compound not only inhibited the growth of Zika and the Chikungunya virus, but it also halted the ability of these harmful viruses to infect otherwise healthy cells. The research team also noted there was a dose-dependent effect in inhibiting these viruses. Curcumin was found to affect the virus's ability to bind with other cells. Another study published in the journal Gut showed that curcumin hindered the hepatitis C virus from entering the human liver cells. According to the researchers, this effect proved especially beneficial, as exposure to the Hep C virus caused severe liver disease and was known to affect more than 160 million people around the world. Researchers were surprised to discover that zinc may have the potential to fight liver disease by suppressing the inflammatory effects of a protein called interferon lambda 3. This new research, published in Nature Communications, proved how beneficial the mineral is in curbing the negative effects of liver disease. Led by Dr. Scott Reed and Associate Professor Gallo Ansteel, the study was a collaboration between Store Liver Center at Westmead Institute and the Center for Virus Research and the Kirby Institute. It offered proof that zinc is a powerful and specific inhibitor for INF3 when it comes to viral infections like influenza and hepatitis C. IFN3 is a protein that's directly related to the tissue damage in the chronic liver disease. It also reduces antiviral activity, and it increased viral replication both in vitro and in vivo. Korean researchers studied the anti-inflammatory properties of Panax ginseng, which is commonly known as Korean red ginseng, for potentially treating arthritis, gastritis, and hepatitis. Their findings were published in the American Journal of Chinese Medicine. Korean red ginseng is a herbal medicine used worldwide and is prepared from Panax ginseng. Some of its active ingredients are ginsengicides, and these exhibit anti-inflammatory and anti-cancer properties. Previous studies have focused on the anti-inflammatory activities of the Korean red ginseng, but the major anti-inflammatory compounds and the mechanisms of suppressing inflammatory processes have not yet been fully explored. The researchers aimed to identify inhibitory saponins in the Korean red ginseng to evaluate their efficacy in vivo and to understand the inhibitory mechanisms involved. The researchers employed in vitro lipopolysaccharide treatment macrophages and in vivo inflammatory mouse conditions, such as collagen type 2 induced arthritis and induced gastritis. Of the ginsengicides, ginsengicide RC exhibited the highest inhibitory activity against the expression of the tumor necrosis factor. The red ginseng extract also attenuated inflammatory symptoms, such as mediated gastritis and triggered hepatitis, without altering toxicological parameters and without inducing gastric irritation. New research has shown that drinking coffee can lower the risk of liver fibrosis, hepatitis, and type 2 diabetes. Coffee has also been shown to lower the risk of prostate cancer and even Alzheimer's disease and stroke. It's the caffeine in the coffee that's the active ingredient, but other sources of caffeine, such as green tea, black tea, and chocolate, may also be helpful in reducing health risks, though the study showed that coffee was what was used to reduce the fibrosis. The most recent study was published in January 2010 in the journal Hepatology, and it was titled "Increased Caffeine Consumption is Associated with Reduced Hepatic Fibrosis." 177 patients were studied over a 6-month period. The group was comprised of close to half female, half male, with 112 chronic hepatitis sufferers. The participants consumed 308 milligrams of caffeine per day, which is considered to be the same as 2¼ cups of coffee. Obese patients who are treated for chronic hepatitis C virus are more likely to have a better outcome if the underlying abnormalities caused by excessive fat tissue are corrected first. This was according to a review published in the medical journal Hepatology. The lead author, Dr. Michael R. Charlton of the Mayo Clinic, Rochester, Minnesota, and colleagues pointed out that obesity is considered to be a metabolic condition, not simply a matter of just being overweight. Obesity in patients with hepatitis C virus infection is associated with inflammation and insulin resistance and a pre-diabetic abnormality of blood sugar. These patients may also have steatosis, which is fatty liver disease, progression of fibrosis, scarring of the liver, and a poor response to interferon and ribavirin, which are the standard treatments for the hepatitis C infection. Patients with the Hep C and obesity-related fatty liver disease are also at a greater risk for more advanced liver disease. Weight loss to reduce the fat tissue is an important first step in improving the response to the treatment. Also important is the treatment with diabetic drugs like metformin to improve insulin sensitivity and reduce fat accumulation in the liver. This might reverse disease progression also. Researchers have found that the golden tick seed plant, which has been used in folk medicine around the world, can protect the liver against injury thanks to its antioxidant and anti-inflammatory properties. A study published in BMC, Complementary and Alternative Medicine, examined the hepatoprotective properties of the golden tick seed using an acute liver injury mouse model. Because the golden tick seed is demonstrated in the study to exhibit a hepatoprotective effect against chemically induced liver injury, it can be potentially developed into a functional food or even a pharmacological drug agent for the prevention of liver disease. Research just published in the American Society of Biochemistry and Molecular Biology's Journal of Biochemistry concludes that a chemical found in blueberry leaves can actually block the replication of the hepatitis C virus, shutting it down. This finding could open up a new and natural avenue for treating chronic hepatitis C infections. Because hepatitis C is localized in the liver, and it can take 20 years or more to develop into a significant disease, the research reasoned that a dietary supplement might help to slow or stop the disease progression over the years. They decided to screen around 300 different agricultural products for potential compounds that might be effective at suppressing the hepatitis C viral replication. They uncovered the strongest candidate for the natural hepatitis C would be the leaves of the rabbit-eye blueberry. Garlic improves the liver's ability to metabolize and neutralize carcinogens. The sulfur compounds in garlic, the most well-known is allicin, promotes the body's detoxifying activities. Lab studies have shown garlic to be antiviral, antibacterial, and antifungal. Garlic is helpful both raw and cooked, but the most effect for the viral control comes from eating it raw. Licorice is an immune system stimulator, and it's antibacterial, antiviral, anti-tumor, and anti-ulcerative. Licorice has a long history of use for coughs, colds, and ulcers. Scientific studies have reported that licorice is a modulator of the immune system. If the immune system is overactive, licorice calms it down. If it's underactive, licorice pumps it up. It increases the number and the aggressiveness of white blood cells. It stimulates interferon production, and it enhances antibody formation. Licorice has a sweet taste and is well loved by some. It can be used as a tincture, a powder, a tea, or capsules. The liver is quite rich in coenzyme Q10, and hence there may be a loss of coenzyme Q10 due to liver damage during viral hepatitis, resulting in a CoQ10 deficiency. It's possible that in most infective diseases and in some of the immunity-related conditions, coenzyme Q10 may be administered for its bioenergetic immunomodulating activities. Typical doses of CoQ10 are from 100 to 400 milligrams per day, with ubiquinol being the best absorbed form. Among other communicable diseases, vitamin D deficiency is involved in the pathogenesis of chronic liver diseases caused by hepatitis B and hepatitis C viruses. You can get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3 to correct any deficiency that you may have.